What is fentanyl? In comparison to morphine, fentanyl is a potent synthetic opioid that is 50 to 100 times more potent. It is a prescription medication that is also produced and used unlawfully. It is a drug that, like morphine, is frequently used to treat patients with extreme pain, especially following surgery. Patients with persistent pain who are physically tolerant to other opioids may also occasionally be treated with it. When you require a higher and or more frequent dosage of a medicine to achieve the desired effects, this is known as tolerance. Fentanyl is marketed under the brand names Actic, Duragesic, and Sublimaze in its prescription form. The most frequent medications involved in drug overdose deaths in the U.S. today are synthetic opioids, including fentanyl. Fentanyl was involved in 59.8% of opioid-related fatalities in 2017 as opposed to 14.3% in 2010. How do opioids work? A class of chemicals known as opioids can be found naturally in the opium poppy plant. Some opioids are produced directly from the plant, while others, like fentanyl, are produced in laboratories by researchers utilizing the same chemical structure, semi-synthetic or synthetic. How is fentanyl used by people? Fentanyl can be administered as a shot, a skin patch, or lozenges that are sucked like cough drops when it is prescribed by a doctor. Labs produce the illegally used fentanyl that is most frequently linked to recent overdoses. This synthetic fentanyl is offered illegally in the form of tablets that resemble other prescription opioids, eyedroppers, blotter paper, nasal sprays, and powder. Fentanyl is sometimes mixed with other substances like heroin, cocaine, methamphetamine, and MDMA by some drug dealers. This is so because fentanyl is a less expensive option because it requires relatively little to induce a high. This is particularly dangerous when drug users are unaware that their medications may include the inexpensive but harmful ingredient fentanyl. They may be using higher opioids than their bodies are accustomed to, which increases their risk of overdosing. How does fentanyl impact brain function? Fentanyl functions by attaching to the body's opioid receptors, which are located in regions of the brain that regulate pain and emotions, just like heroin, morphine, and other opioid medications. The brain becomes less sensitive to the opioid after repeated use, making it difficult to experience pleasure from sources other than the drug. Drug use and drug seeking become a way of life for addicted persons. The effects of fentanyl include really happy, drowsiness, nausea, confusion, constipation, sedation, difficulties breathing, unconsciousness. Fentanyl overdose is possible. Fentanyl overdose is possible, yes. When a medicine causes severe side effects and life-threatening symptoms, an overdose has occurred. The respiration of fentanyl overdose victims may become labored or cease entirely. This may result in hypoxia, a condition when there is a reduction in the amount of oxygen reaching the brain. Hypoxia can cause lasting brain damage, death, and comas. How may an overdose of fentanyl be treated? As was already noted, many drug traffickers mix the less expensive fentanyl with more expensive narcotics like heroin, cocaine, MDMA, and methamphetamine to boost their earnings, making it challenging to identify the exact drug that is responsible for an overdose. When administered quickly, the medication naloxone can treat a fentanyl overdose. It functions by quickly attaching to opioid receptors and preventing opioid medication effects. Fentanyl, however, is more potent than other opioid medications like morphine and may need for several doses of naloxone. As a result, the most crucial thing to do if you think someone has overdosed is to call 911 so that they can get help right away. If medical personnel assume an opioid medication is involved when they arrive, they will deliver naloxone. Naloxone is offered as a nasal spray, Narcan and Cloxato, and an injectable, needle, solution. After the final dose of naloxone is administered, patients should continue to be watched for another 2 hours to ensure respiration does not slow down or cease. There are rules in some places that permit pharmacists to give out naloxone without a patient's own prescription. The nasal spray variants of naloxone can be used to revive an overdosing person by friends, family, and neighbors. Can using fentanyl result in addiction? Yes. Fentanyl's potency makes it addictive. When using fentanyl on a prescription as directed by a doctor, a person may develop dependence, which is marked by withdrawal symptoms after stopping the medicine. Although a person might be reliant on a substance without being addicted to it, addiction can occasionally follow dependence. The most severe type of substance use disease is addiction, SUD. SUDs are characterized by obsessive drug seeking and use that can be challenging to rein in, even when it has negative effects. When a person has a drug addiction, they continue to take drugs even though they harm their health or cause problems at job, school, or family. Mild to severe SUDs are possible. When fentanyl addicts quit taking the drug, they may experience severe withdrawal symptoms that can start as soon as a few hours after the last dose. These signs consist of bone and muscle discomfort, issues with sleep, constipation and vomiting, shivering and goosebumps, involuntary leg movements, powerful cravings. Many people find it exceedingly difficult to discontinue taking fentanyl because of these symptoms, which can be very painful. For fentanyl and other opioid withdrawal, medications are currently being researched. Lofexidine, a non-opioid medication intended to lessen opioid withdrawal symptoms, has received FDA approval. Additionally, a small electrical nerve stimulator called an S2 bridge device, which is positioned behind the user's ear, can be used to help manage symptoms for up to 5 days during the acute withdrawal phase. The FDA approved the mobile medical app Reset in December 2018 to assist in the treatment of opioid use disorders. This program is a prescription for cognitive behavioral therapy and ought to be used in conjunction with care that entails contingency planning and buprenorphine. How is addiction to fentanyl treated? Fentanyl addiction has been demonstrated to respond well to medicine combined with behavioral therapy, just like other opioid addictions. Medication, buprenorphine and methadone reduce cravings and withdrawal symptoms by binding to the same opioid receptors in the brain as fentanyl. Naltrexone, a different medication, disables opioid receptors and stops fentanyl from working. With their healthcare professional, patients can go over available treatments. Counseling, behavioral therapy for opioid addiction, including fentanyl addiction, can help people change their attitudes and drug-related behaviors, develop healthy coping mechanisms, and maintain adherence to medicine. Several instances include: the patient's drug usage expectations and behaviors are changed through cognitive behavioral therapy, which also helps the patient handle stress and triggers. Contingency management, which rewards patients with points based on clean drug testing via a voucher-based system. The things that promote healthy life can be obtained with the points. A patient's conflicted sentiments about changing are addressed by the patient-centered counseling technique known as motivational interviewing. These behavioral treatment strategies have been successful, particularly when combined with medication.